Nurofen tablets, it has a rapid effect on pain, antipyretic and anti-inflammatory action. The analgesic effect of the drug lasts up to 8 hours. Indications: headache, migraine, toothache, condition after tooth extraction, neuralgia, myalgia and arthralgia, injuries of the musculoskeletal system and of moderate severity, rheumatic pains, algodysmenorrhea, cold symptoms and comfort, fever origin. How to use: for oral administration. Patients with hypersensitivity of the stomach are recommended to take the drug during meals. Adults and children over 12 years old. Inside 1 tablet, 200 mg up to 3 to 4 times a day. The tablets shall be taken with water. To achieve a faster therapeutic effect in adults, the dose may be increased to 2 tablets, 400 mg up to 3 times a day. Children from 6 to 12 years old, 1 tablet, 200 mg up to 3 to 4 times a day. The drug can be taken only in a child's body weight of more than 20 kg. The interval between taking the tablet shall be at least 6 hours. The maximum daily dose for adults is 1200 mg, 6 tablets. The maximum daily dose for children from 6 to 8 years, 800 mg, 4 tablets. If when taking the drug for 2 to 3 days, the symptoms stop or increase, it is necessary to stop treatment and exclude the disease. Contraindications: hypersensitivity to ibuprofen or any of the components that make up the drug, erosive and ulcerative disease of the gastrointestinal tract, severe heart failure, severe liver failure or active liver, renal failure or moderate severity, pregnancy, 3rd trimester, children aged up to 6 years. Special conditions: it is recommended to take the drug in the shortest possible course and in the minimum effective dose necessary to eliminate symptoms. If you need to take the drug for more than 10 days, you should consult a doctor. Patients who experience dizziness, drowsiness, lethargy, or visual disturbances while taking ibuprofen should avoid driving. Side effects: the occurrence of side effects can be minimized if the drug is taken slowly, at the lowest dose required the symptoms. Side effects are dose dependent.